Over the years, I've had many people that have come to me in pain, and many times they've gone to many other health practitioners, medical doctors, orthopedists, other chiropractors, and for various reasons, these problems haven't resolved. And so I put some thought into why these problems aren't being resolved, because many times in my office, these things can be resolved very shortly. I've seen sometimes in a day, sometimes even in 5 minutes. I've solved problems that have gone on for years. And I've wondered why it seems so obvious to me is not so obvious to the people who have the problems and even to other doctors who are, some of them are very well trained. And I believe the reason for this is because we tend to look for the problem where the pain is. And in actual fact, many problems are caused by problems elsewhere in the body and are referred or reflexively appear somewhere else in the body. And unless you understand this referral system, then you'll always be looking in the wrong area because you'll be looking where it hurts to solve the problem. So what I've done is written a book here, and I've divided it up into three main areas. To understand this problem, first, I've talked about two major classes of acupuncture points. The reason why I've chosen acupuncture is because acupuncture is designed about relating different parts of the body to each other. It's not primarily dealing with local problems. If you see acupuncture charts, you'll notice lines going all over the body. And these lines are ways that the acupuncturist connects one part of the body to another. So what I've done is taken two classes of acupuncture points. One are called association points, which run like little dots right alongside the spine on the back. And the other are called alarm points, which occur over organs that are inflamed. And I've described to you in this book why you have these two types of points, why God would create two types of points that both reflect disturbances in organs. Why not just have one? In fact, why not just have the organs themselves hurt? So I've discussed why that occurs and why it's useful to understand this for understanding your problems. After I've done that, I then talk about case histories so that you can see in actual people who've come in many times, who've gone to doctors for years without solving their problem, how easy it is to fix them if you address the right problem. And so I go through a whole bunch of different patients and show you examples of what can occur if you do the right thing. And in the last part of the book, I talk about basically the philosophy of longevity to prevent most of these problems from occurring. Because if you deal with the longevity as a philosophy of health, you will avoid most diseases, most pains, and live a happier, longer life with the least effort. So that's why I think you should learn more about this topic, because it'll help you in a lot of different ways.